And welcome back to this episode. Today we're going to be talking about head injuries and traumatic brain injuries. In Ireland every year there's between 9,000 to 11,000 people that suffer with brain injuries, and they go from little minor things to you falling over, banging the side of your head, to full blown to be incapacitated for the rest of your life. So let's talk about the anatomy and the physiology of the nervous system. So in hindsight, it's like the electrical system in your house, inside your front door or wherever it is. You have the electrical box, the trip switches and all that, and the human body is no different. So we have two types in the body. We have the central nervous system, which is your head in the middle in your spine, and you have the peripheral nervous system out on the outside. And it's open to all types of diseases, trauma, and medication as well will upset that. And then you have the meninges. So a lot of people often heard of meningitis. I'm going to cover that in one of my up and coming videos shortly when we're dealing with pediatric patients as well. So the central nervous system is protected by three layers, and is around the three layers then. So you have the dura mater, the arachna and the pia. So there's three layers. So one is like cling film, very fine, very fine. It's like wet tissue. Second one then is like paper, and the third one, and the outer fibrous one is like a cloth sack around a coal bag, something onto that nature. Okay, so around the inside of the dura arachna and pia mater we have fluid. It's called CSF fluid. And often you hear about people in trauma and fluid coming from their ears or fluid coming from the nose. But what happens is it encapsulates the brain and protects it. It also acts as a shock absorber as well, and I'm going to show you that in a few minutes. So another thing that it does, it nurtures and cleans out the whole system as well. How much do you think is produced in the brain every day? They're produced in 4 ventricles in the brain. It's about 400 to 500 mil. Because the brain is a very highly complex organ within the body and the system, and it takes about 15 to 20% of all the blood that's produced in your body, because it needs loads and loads of oxygen. So going back to our earlier videos when we talked about cardiac arrest management, two most important organs in the body was the brain and the heart, and that's why we were starting with our CPR as well. When we look at the size of the brain is a spongy item. So if you ever pick up a sponge and you wet it and it gets really heavy, you know, on the big bat sponges, you could kind of equate it to the brain. The average human brain weighs about approximately 1.36 kilos, which is a fair weight if you think about it. Now you think about it when you fall off a ladder, if you're in a road traffic accident and you have one car coming this way and another coming this way, and both of them at, let's say, 100 kilometers an hour, that's a 200 kilometer an hour impact, and you have something on your head about the size of, we'll say it's about 5, 7, 8, 10 pounds, whatever the case may be, and the deceleration force of that, and children's brains can weigh in around 0.4 kilograms as well, a little on a pound, depends on the age and all them kind of things. Many different kind of head injuries as well. We have concussion. This is the most common type of head injury. We have contusions within around the brain as well, where that's a bang. We have intracranial hematomas, or basically bleeds within inside the brain. They cover a multiple facet of different kind of illnesses as well. Another one then is the skull fracture as well. So we talked about fractures last week. A skull fracture is a break to the skull, and all of these can be life-threatening. We look at concussion, the symptoms of it. So you're talking about headache or pressure to the head. We're talking about nausea and vomiting as well. So normally what happens when you get an insult to your body, your systemic nervous system kicks into play, and as a result of that you get into the fight or flight response and you want to get sick. Balance, dizziness, another one. Bothered by the light, another one. That's a thing that's very common. And if you suffer with migraines, absolutely horrendous thing to suffer with, or headaches. And you'll often find that people with the light can't tolerate light going into their eyes. Feeling sluggish, hazy, total confusion as well, and just not feeling all right. And anyone in this kind of symptom needs to go and see a doctor. So when we're talking about a belt to the head, so for argument's sake, you're outside and work and you're in the building site and something falls on top of your head and you're wearing your helmet if you're lucky, or if you're at home you stand up, and we've often banged our head. But if you feel for a boggy mess like we did in the head to toe the evening, what happens if you feel or you think that the skull is fractured? You'll find stiffness, tenderness, trouble bending over, dizziness, all these kind of things that can be life-threatening. With traumatic brain injury as well, and this can happen multiple forms of stuff. So basically you get a bleed, we'll say, from a kick of a horse in the head, or a belt of a hammer, or an assault, or somebody gets a poke in the head, and there's lots of reported cases around the world of people being struck once, fall over, bang their head. And it's the least little thing can do damage to you here. So you have to be very careful and very aware about when you're dealing with it. So when it comes to managing a patient that has a traumatic brain injury, and we talk about in our earlier videos about the sample history, a thing I like to do inside and work is when you go along and you ask somebody their name, they'll give you, so ask me, my name is Donald, how are you today? What day is it? Today is Sunday, for argument's sake. What date is? Most people have to look at their watch for the date. Most people don't know politicians. So use a question that's relevant to the person. What's their wife's name or what's their children's name? And what I normally do as well, if I'm bringing in somebody, I'll ask them a question. How are you now, John or Mary? Next thing I'd write it down. What did you say your name was again? John, for argument's sake. I keep asking and I keep asking, and after 20 minutes they keep asking me, why did you keep asking me the same question all the time? Well, that's a good indicator that they're neurologically intact. If you find that they start to get sluggish, I would start worrying. Other things that you have to be careful as well is when you're looking at pupils as well. Pupil size are another huge thing. Whether they're blown out or constricted, or you could get one or the other, could be a good indicator. Slurred speech, as we talked about as well. And these can be huge factors as well as doing your head to toe. Look at this. So imagine that this is your brain, and in around it the cerebral spinal fluid, as I talked about, and that keeps your brain lubricated and cushioned, as you can see as I move around the glass. Now, for argument's sake, a simple little thing like a stone, and you fall in the back of a stone and you land on your head, you could actually end up with a fractured skull. So another problem we're going to have here as well then is if I take out the fluid, as you can see, I'm going to pour out some fluid here like that, and I lose it out. And the next thing then, I suddenly have this and I get involved in a road traffic accident, or fall from a height, or fall and hit my hand off a curb. Next thing we could get this. And the next thing, we have a fractured skull. So the problem with it is, yet again, as we get older, what you're going to find is that the brain is going to shrink. It's going to go from a full-size egg to maybe a 3/4 size egg, and it can actually move more inside in the body. And that's how delicate our whole system is here. So that's why when we talk about, you know, children out on bicycles, horse riding, working on in a building site, wearing a helmet is the most important thing you can ever do, because you only get one brain and you only get one crack at it, literally.